Good morning. In this video, I'll talk to you about big toe osteoarthritis, and more specifically, about a somewhat unusual surgical procedure that can be offered to some patients, but not all, as an alternative to the traditional surgery that permanently blocks the big toe joint. The big toe joint is formed by the metatarsal bone and the proximal phalanx. The joint is covered by a smooth, tough layer called cartilage. In osteoarthritis, the cartilage gradually disappears, allowing the two bones to rub together. If the osteoarthritis is very advanced, it can cause pain, difficulty walking, swelling of the big toe, and stiffness, including difficulty walking on tiptoe. As you can see, in this patient, the big toe is completely blocked and unable to move upward, partly due to the presence of a bony protrusion, called an osteophyte, on the upper part of the metatarsal. Diagnosing osteoarthritis of the big toe is easy because an X-ray is sufficient. Only in some cases is an MRI or a 3D CT scan also necessary. In the case of severe osteoarthritis, the options available to us are the following. 1. Perform cortisone injections. These are always performed under X-ray or ultrasound guidance, because otherwise we cannot be sure that the needle is in the right place. Unfortunately, cortisone injections can have a limited duration, and above all, cannot be repeated too many times because cortisone is not a good friend of our body. 2. As a last option, we can consider surgery, which may consist of simply removing the dorsal osteophyte, but in the case of severe osteoarthritis, this simple procedure is not sufficient. Alternatively, we can propose a total big toe prosthesis or the classic arthrodesis procedure, which means blocking the big toe joint. Without wanting to go into too much detail, I can tell you that the prosthetic procedure involves cutting the skin for a few centimeters. The cut is progressively deeper until reaching the joint capsule and the bony surface of the metatarsal and phalanx. The bones are then prepared with a small, high-speed saw, followed by preparation with small rasps to allow the metal component of the prosthesis to be inserted at both ends of the joint. The components are inserted interlockingly, knowing that over time, weeks, the bone will grow through the rough surface of the prosthesis, thus allowing for complete integration of the artificial components. After inserting the metal components, a spacer made of high-resistance silicone is then inserted to allow the joint to slide smoothly without the metal components coming into contact with each other. Arthrodesis, as we've already mentioned, involves the complete and, above all, permanent blocking of the big toe joint. The procedure is performed with a surgical incision, very similar to the one you've already seen. In this surgical technique, we use spherical drills to remove the last remnants of cartilage until we reach the layer of healthy bone, which is immediately beneath the cartilage. After the preparation with the drills, we place a metal plate with screws that ensure excellent stability over the following weeks, until the bone is completely healed. The plate and screws should not be removed unless they cause discomfort due to rubbing against the shoe. I invite you to watch the video I made specifically for big toe arthrodesis by clicking the link at the end of this presentation. After surgery, whether it's a prosthetic or an arthrodesis, you can put your entire body weight on the ground, using a specific shoe with a flat, rigid sole that you should wear for 4 to 6 weeks. We practically always propose a peripheral anesthesia, which is done with a small injection in the calf, always under ultrasound control. It is an ultrasound instrument. This type of anesthesia is not only very effective in controlling pain during and after the operation, but also has the indisputable advantage of not causing the side effects of other types of anesthesia, such as narcosis or spinal anesthesia, i.e., the one done with an injection in the back. Peripheral anesthesia for the calf is always offered even for the procedure. I want to talk to you about today the so-called interposition plasty. The aim of this operation is to obtain good mobility of the toe without inserting metal material such as the prosthesis or the plate and screws we saw earlier. In this case, too, we need to make a cut of a few centimeters, through which we reach the plane of the bone. We can now identify and isolate the capsular tissue present in the superior portion of the joint. This tissue is brought downward to completely cover the surface of the bone we previously cleaned. In this way, the soft tissue creates a protective layer that prevents the two bones, the metatarsal and the phalanx, from rubbing together. To prevent this biological, and therefore not artificial, cushion from remaining in the desired position, we must place stitches that keep it firmly attached to the bone, where it will then undergo a healing process. After surgery, you must wear the flat-soled post-operative shoe, identical to the one I showed you earlier. Even in this case, the shoe will be worn for a few weeks. You will definitely need physical therapy starting in the second post-op week to keep the joint mobile and prevent it from becoming stiff over time. For the first 2 weeks, it's important to avoid getting the wound wet, such as when showering. To reduce this risk, you can use common waterproof bags available at the pharmacy. To be extra safe, I recommend reinforcing these bags with a layer of plastic, such as food wrap, trying to reach up to the knee. In this case, you see a patient of about 70 years old who, more than 12 months after surgery, is walking well, even able to stand on tiptoe. As with all surgical procedures, there are naturally risks and complications that should be discussed with your surgeon before deciding to undergo the procedure. Among these, I emphasize the risk of infection, deep vein thrombosis, and the risk that the operated foot may remain swollen for several months, thus making it difficult to wear closed shoes. It's also possible that this procedure won't work. The joint may still be painful or stiff. If it's clearly unsuccessful, despite physical therapy, your surgeon may recommend another procedure, specifically arthrodesis, which involves fusion of the joint. I invite you again to watch the informative online video on arthrodesis surgery. And if you think this video was helpful to you or someone else, please subscribe to the channel. Thank you.